about the various fertility treatments, of which the first one being the sonographic guided natural relations. We advise the patient to undergo follicular study, targeted ovarian sonography, in which the patient undergoes sonography every alternate day till the day that the egg ruptures from the ovary. Once the egg gets released from the ovary, we advise the patient and the couple to keep relations that day as well as the next day. The second procedure being IUI procedure, which is called the intrauterine insemination, in which on the day of rupture we advise the patient's husband to give the sample for semen washing. That sample is inserted inside the patient's uterus so that the sperm and the egg are very close by, and that improves the success rate of the conception by around 20%. The third procedure being the IVF procedure. Now the newer procedure of IVF is called the ICSI procedure, that is the intracytoplasmic sperm injection, in which what we do is first the eggs are hyperstimulated so that we get a cohort of eggs. Once the eggs reach to a particular size, then the over pickup procedure takes place in the operation theatre, in which we make sure that all of the eggs are retrieved out, and then the rest of the procedure takes place in the lab. And the best of the eggs and the sperms are selected, and then one sperm is injected under a very high microscope into a single celled egg. After incubation, after the third or the fifth day, we introduce the pregnancy inside the womb of the patient. This is called as the embryo transfer. The fourth procedure is surrogacy. There is a very bad, severe medical condition of the patient in which the patient cannot go through the process of complete conception till 9 months, and it may be detrimental or harmful to the body. Or there is some other like Asherman syndrome, in which the internal lining of the uterus is completely destroyed. So in such cases, when the pregnancy cannot implant egg and the husband's semen, and a pregnancy is formed in the lab, and then this pregnancy is introduced into the uterus of another woman under a proper lawful contract, the baby is again returned back to the lawful birth genetic parents.